I do a lot of complex breast revision surgery in my practice. It's one of my favorite things to do. So this means that patients come after they had surgery done elsewhere, and they come to my practice for me to correct a problem, a complication or an issue they've been having with their implants. So let's go over a couple of these presentations. First is implant malposition. Implant malposition means that the implants are too far apart, they're too close together, or they're too low on the chest wall. And out of these, the most common is what we call bottoming out. And that means that the breast pocket is over dissected, or that the implant that was chosen during the previous surgery was too heavy, and over time the implant dropped and the distance between the nipple and the breast fold is too long. This is a complicated problem to treat because you have to take the implant out and you have to re-establish the native inframammary fold or the breast fold. And in doing that, you stabilize the implant back where it should be and reconstitute the shape of the breast. Capsular contracture is another very common problem that patients present to my practice with. Basically, any prosthesis that's put in your body develops a capsule. This is a normal and natural response. Capsular contracture is the excessive production of the scar tissue around the implant that over time distorts the breast and can even be painful. So what we do to correct this is the implants come out, and if it's minor, you release the capsule, that's called a capsulotomy, or you excise it, and that's called a capsulectomy. And then you have to either change the implants or remove them entirely to reconstitute the shape and the footprint of the breast. Another very common reason patients present to my practice is for something called a waterfall deformity. A waterfall deformity is when the implant is in a good position on the chest wall, but the breast tissue over time has stretched and has drooped over the implant, kind of like a waterfall, why we call it the waterfall deformity. Patients usually present to my office pinching the piece of tissue in the lower half of their breast that they find makes their breast look wide and stretched out and flat. And the way we fix this is to reconstitute the breast tissue by doing a breast lift. So you raise the areola on the implant and retighten the skin to reconstitute that shape. The last category of patients simply want their implants out, and we call this explantation. There's a variety of reasons why people want their implants out, but whatever the reason, depending on their anatomy, there's different ways we approach it. Some patients just need their implants out and they have no breast ptosis, they have no breast droop, so the skin is just closed, implants are out, and they look great. Most patients, in my experience, need an additional procedure. So if the nipple's not in a good position on their breast mound, they need a breast lift after the implants are out. And if over time their breast tissue has thinned or attenuated from the implant, they need fat grafting to volumize the breast in addition to the breast lift.